A very warm welcome, everyone. I, Dr. Ritika Dhiman, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who tirelessly look after our well being day and night. Voice of Healthcare, along with our supporting partner, Apollo Hospitals, has taken an initiative to recognize National Doctors' Day through our video series, Know Your Doctor, which aims to showcase the diverse interests and passion of our esteemed doctors. On this National Doctors' Day, let us express our gratitude to these extraordinary individuals. So let's get started with the introduction. I welcome Dr. Maharshi Desai, Senior Consultant, Internal Medicine, Apollo Hospitals. Welcome, Dr. Desai.
Hello, Rikita. Happy Doctors' Day to you and all my fellow doctors. It's nice joining you on Voice of Health on National Doctors' Day.
Thank you so much, sir. Same to you. To begin with our conversation, are there any movies recently that you saw and that have a significant impact on your mind?
Yeah, I just recently happened to see actually, it was an old movie, Awakening. It was released in 1990. The actors were Robert De Niro and Robin Williams. It was a very interesting story about encephalitis lethargica and how people overcame that thing. You should see it movie once. It is especially being a doctor, you would enjoy that movie. What set me thinking about is that many a times the problem is there in front of our eyes, but it is so obvious that we fail to recognize that as a problem. And because we fail to recognize a problem, we fail to understand that there could be a solution to a problem. So, what message which I got from seeing that movie was that there are problems around us in terms of clinical care and new diagnosis or new therapeutic options. But sometimes we become so blinded with the routineness of our care that we fail to see it as a problem. And because we fail to see it as a problem, we many a times miss an opportunity to treat those problems. That was one lesson which I was from that movie. And second message was that any new miracle medicine is of course a miracle, but then it also needs to stand a test of time as to if understand whether it becomes a double-edged sword and produces some unintended side effects. So these are the two messages which I got from seeing. Nothing new in that, but it was a nice, interesting little movie. I would definitely recommend whenever you get a time. It's available in OTT. The movie is Awakening. It's an old movie, but you would enjoy.
Sure. So I'll surely watch that. I haven't seen The Awakening. I've seen a lot of other doctor series, House MD, and there is one where one doctor is autistic. I forgot the Good Doctor. So I have seen those series. Yes, but yeah, I surely watch Awakening. And you have rightly mentioned that we are failed to see, due to the routineness, we are failed to see the interesting things that are happening or the issues that are there. And without knowing that there are issues, we'll not be able to solve it when we don't know that they even exist. So that's a very good message from that, and I'll surely, on your recommendation, I'll surely watch that movie. Moving on with our conversation, are there any particular medical advancements or technologies that you find intriguing or believe will have a very significant impact on the future of healthcare?
Yeah, definitely. In medicine, we are in a very exciting phase. And if I look forward in 5, 10 years down the line, one thing is definitely which is actually present now, but it would come in more force is a precision medicine. Precision medicine combined with genomics to give a exact diagnosis at a molecular or a genomic level. And because we have an exact diagnosis, we would have an exact care so as to have a better benefit, better effect profile of our medicines with a lesser side effects. I'll give you one example. Say, for example, diabetes. Now, let us, for sake of discussion, assume that we both have diabetes. Let's see, we don't have diabetes. But understand that it's a single disease. So, whatever medicine you take should be applicable for me, fair enough, but it's not so. It's a polygenetic disease with a multifactorial impact as far as lifestyle and other environmental condition is different. So in essence, your diabetes might be different from mine. So your therapy, the treatment that you take would be different than mine. So this is applicable to each and every other problems also, cardiovascular medicines, oncology. We have already started going into not only diagnosis of cancer, but the molecular basis of cancer. And because of that, we are able to give a targeted therapy which would help a better disease control with a lesser side effects. See, all these exciting developments are happening, and it is already getting into a routine clinical practice, and in near future we would have much more of such precision medicine with the help of genomics in understanding of disease, diagnosis of disease, and the treatment of disease. So that is one area. And second area, when we talk about future, the elephant in the room is of course artificial intelligence. We cannot not talk about artificial intelligence now, and with regards to medicine. I think it's a very exciting field. But before that, probably there is one fear of artificial medicine taking a role of a doctor. Now, before going on to that, let's go back to history. Now, 30 years ago, when computers were just getting its foothold in the society in large, I remember people in banking industry and other offices were resisting the use of computers, saying that it will take away their jobs. Now imagine the scenario 30 years down the line, asking a banker or anybody else that you are not going to use your computer. It is unimaginable. So that's what is going to happen with AI, and at least with medicine. That 5, 10, 50 years down the line, probably it would be inconceivable to not practice without a help of artificial intelligence. The other factor that it would replace the need of doctor, at least in medical field, it's not going to happen. See, you can have a good algorithms, protocols given by a faceless AI, but where will you get a human touch of a doctor? Okay, a warm reassuring smile that look, you would be okay, don't worry about your illness, we will take care of you.
The
That
emotional and
emotional
psychological
connect
aspect.
will not be there.
Yes.
Okay,
Yeah.
so it's not just about diagnosis and treatment. The medicine is also about a human connect, which obviously an AI would not be happening with that. So having said that, I think AI is a new, interesting, and exciting way of treatment going forward, and we should embrace it and let us understand what things we should be able to do it, which we are not able to do as of now without AI.
Right. I totally agree with you that we have come a long way in terms of precision medicine, genetics, and we have a long way to go. So, probably in the next 10 years, we'll see a lot of change on how we treat patients. And you talked about AI, so it will be an additional tool for the doctor to use to make their life easier, but not we cannot replace a doctor. There are, as you have mentioned, there are other aspects. It is not just the diagnosis and treatment of a disease. It's about the psychological aspect and the emotional aspect that a doctor touches upon, and sometimes those aspects helps in the diagnosis for a disease, for a particular disease. So I totally agree with you. And moving on to the end of our conversation, is there any message that you would like to give to your fellow doctors, budding doctors, junior resident, senior resident, yeah, the doctor fraternity?
Yeah. The message to my fellow doctors is that I, with warm regards, welcome my fellow travelers in this journey called as medical profession. It is in equal measures a rewarding as well as a exciting journey that we have undertaken. uh, there are a lot of expectations from us, from the society, from the patients. we on one hand we have to fulfill those expectations, and at the other end we also need to take care of our own expectations in terms of our mind and in terms of our body. So in focus of fulfilling expectations of society, please don't neglect your own mind and body. That is the message that I want to give. Whenever you have a problem, physical or emotional, the doctor fraternity is always available, and probably you will need to approach a doctor anyway, because they are the best person to understand your predicament, if at all, whatever it is. So my message to each and every doctor is that you are not alone in this journey, in this trial and tribulations in the field of medicine. Let us have a shared journey going forward. Thank you.
Right, right. And we are all there for each other.
Exactly.
Yes, yes. So with this, I would like to end this conversation here. And I would like to thank you and all the doctors who selflessly serve our nation's health. And together we salute your dedication, compassion, and unwavering commitment to our health. So thank you so much, Dr. Desai, for this interesting conversation today.
Thank you, Ritika. It was nice talking to you. And once
Same here.
again, happy Doctor's Day to all of you.
Thank you so much, sir, and same to you.
Thank you.